common treatments for prostate cancer, I think traditionally most people think about surgical removal of the prostate, and that's undergone an unbelievable evolution over the last 2 decades, such that now minimally invasive robotic-assisted laparoscopic prostate surgery is done, where the prostate can be removed in approximately a 2 to 2.5 hour operation. A catheter is left in the bladder that's left in place for approximately 1 week, and the total recovery is 4 to 6 weeks. But surgical removal of the prostate is now done in most cases as a robotic technique. Some patients are either not great candidates for surgery, don't like the idea of a surgical removal of their prostate or some of the consequences that may exist with surgical removal of the prostate, and those patients are potentially more interested in minimally invasive procedure where the prostate is not physically removed. The cancer is simply destroyed by several different modes of therapy, whether it be radiation by itself, which typically involves a treatment a day, 5 days a week for several weeks, or placement of radioactive seeds in the prostate, which tends to be an outpatient procedure, or as I referred to earlier, cryoablation of the prostate, where we can actually freeze the prostate, either a portion or the whole prostate, and again, the prostate is not removed but left in place. With respect to prostate brachytherapy, which is placement of radioactive seeds into the prostate, that's something that has been around for a long time and initially sort of fell out of favor, but as technology has changed, radiation seed production has changed, ultrasound technology has changed, it has become a well-recognized, accepted form of therapy by the American Urologic Association, and it's a treatment option that I have particular interest in. I've been doing brachytherapy since 1997, started it when I came here in 1999, and we used to perform brachytherapy using radioactive iodine seeds, which has a radioactive half-life of 60 days, which means there's some prolonged symptoms. About 4 years ago, we transitioned to using radioactive cesium seeds, which have a much shorter half-life, so that the patient has symptoms for a much shorter period of time. And patients who are candidates for brachytherapy tend to be people who have low volume disease, lower grade prostate cancer, prostates that are not particularly enlarged, and not a lot of significant obstructive voiding symptoms. So in my practice, it's really great for patients who are perhaps a little bit older, who have low volume disease, who don't really like the idea of a surgical procedure to remove their prostate, and also perhaps from a geographic standpoint don't like the idea of coming for radiation daily for multiple weeks. And in that case, it's basically an outpatient procedure where 2 separate procedures are required. First, an ultrasound at the hospital to specifically measure the prostate and plan for how many needles and how many seeds need to be placed, and then a second procedure that takes 60 to 90 minutes under anesthesia that's done as an outpatient, where a multitude of needles are placed in the perineum, which is the space between the scrotum and the rectum, and using ultrasound guidance, we position the seeds within the prostate gland and distribute them uniformly, so the entire prostate is exposed to the radiation that is emitted from those seeds over a period of time. And we've had great success over the past several years. We've looked at our data and our numbers sort of roughly, and we're having great outcomes, and it's a great collaborative effort between the urology department and our radiation oncology colleagues. Cryoablation of the prostate is also something that's been present for a long time, but in the years past, it was recognized really as a salvage therapy, meaning someone who had previously chosen another treatment option, typically radiation, and then had a rise in their PSA suggesting that the treatment had not been entirely effective. Cryotherapy could be done as a salvage therapy to try to freeze the area of the prostate where perhaps there was some persistent abnormalities. More recently, again, with improvement in technology and ultrasound imaging, cryoablation of the prostate has become well recognized by the American Urologic Association as a reasonable treatment option for patients with prostate cancer. Again, it's best for people who have a prostate gland under a certain size. And the only difference between cryotherapy and brachytherapy is, unlike some of the radiation modalities that the results may depend on the grade of the cancer, typically the prostate tissue is frozen regardless of its grade, and In some cases, that may be a better option for people, but that typically tends to be an approximately 90-minute to 2-hour outpatient procedure where cryoprobes are placed into the prostate gland using ultrasound guidance, and then the prostate, using a combination of argon and helium gases, is frozen, then actively thawed, then frozen and actively thawed 2 cycles. And in doing so, it creates a massive change in extracellular water that causes the prostate cancer cells to rupture. And in those patients, after the procedure, they go home with a catheter in place for a few days just because of some prostate swelling. They're back to normal activity quickly, and we begin to file their PSA approximately 3 months after the procedure and continue to do that for a period of years afterwards. It's important to note that with cryotherapy and with brachytherapy, one of the big risks that some patients don't like is the idea that after prostate cancer surgery, where the prostate is surgically removed, there may be a risk of significant incontinence where they may have to wear an absorptive pad that may be lifestyle altering. And in general, both with cryotherapy and brachytherapy, there's very little to no risk of stress urinary incontinence. There can be some transient urinary symptoms such as frequency and urgency and so forth. Additionally, one of the other aspects of prostate cancer surgery that people are concerned about is the possibility of erectile dysfunction. And nerve-sparing radical prostatectomy robotically can be done, and people can regain the ability to achieve an erection, although it's not right away and it takes time. There is a risk of erectile dysfunction with brachytherapy and with cryotherapy, and again, we counsel patients as to the priority that is in their life. But it certainly does afford patients some benefits relative to surgery with respect to recovery, anesthesia risk, and some of the urinary symptoms that they may be concerned about.